energy follows intention, and energy follows attention. So wherever you direct your intention and attention is where the energy will follow. So you can really influence your day, you can influence outcomes, you can influence your interactions with patients, and even your patient's trajectory by the intentions that you set and the space that you hold when you enter into a room to examine a patient for whatever it might be.
Afre Guam and beyond, I'm Dr. Nguyen. I am here with Dr. Erika Capelluti. Did I say that correctly? So we are here in San Diego at the AIHM conference, and Dr. Cappelluti is actually the fellowship director for AIHM, which is the fellowship I am currently enrolled in and officially a graduate of today, or as of today. So I wanted to feature Dr. Erika and kind of ask her about a little about her journey, and she's also the faculty of one of our modules, which is BIOFIELD medicine, which is something very new and very interesting to me. So I wanted to ask her to touch a little detail on that. So first of all, thanks for having, taking the time here to talk with me. I know it's really busy at the conference and it's hard to find time. But yeah, I know you started off as, a critical care pulmonologist in the hospital setting. So what shifted you to go into integrative medicine?
Yeah, so I actually started out in research first because I thought I wanted to be a researcher, and then shifted gears and wound up in medicine. And I would say that I have a lifelong interest in alternative modalities, and I had some interesting experiences when I was growing up and when I was in high school. Learned about parapsychology at a very early age, which was great fun, and just always knew and had an interest that there were probably some things in the world that maybe we didn't quite yet understand, that our technology couldn't explain, and the biofield happens to be one of those things. So alternative therapies were definitely kind of a part of my life for many years. And then when I got into medicine, I again had some life experiences that brought integrative modalities front and center into my world. And I learned about a master's program, and then I learned about the original AIHM conference and board certification through that organization. And so I took on the integrative piece, wholeheartedly, probably about 20 years ago.
Yeah. So was there like one case or one thing that really, a patient that you saw under mentorship or something that sparked you to really go in that direction?
No, I mean, it wasn't so much a patient, it was my own personal journey that really made me sort of seek out, some of the alternative therapies that were available at the time. So I was exploring meditation. I was having readings done by, people that could channel angelic beings, and some of this stuff would be considered to be on the fringes, certainly back then, 20 years ago. And did some experiential stuff in Chinese medicine for my own personal growth and development and my own personal journey. So it wasn't inspired as much by anyone that I was treating at the time. It was just more, for me.
Yeah, for your own personal journey. And
exactly.
And, you're certainly the faculty of biofield energy, and this is something that really perked my interest, because I know it's there and I couldn't really palpate or really explain it. And also when you're in the traditional model, it's kind of poo-pooed off or just, put to the side. But I know that phenomenon is there, and there's more and more evidence and scientific research coming out of that. So could you explain a little bit about what's biofield energy and maybe some of the science or the things, how it's been applied in day-to-day clinical life or clinical experience?
Yeah, sure. I mean, You know, the idea of the energy body has been around for, you know, thousands of years. I mean, when you think about the different cultures around the world, it's called different things. You know, in traditional Chinese medicine, it's called qi. Yeah. It's called prana in others, or ki, depending upon which indigenous, you know, culture you explore. And I think, you know, when I teach biofield theory and application, I tell folks that if you think about the evolutionary history of our world, you know, there was a time when we thought that the Earth was flat. Yeah. Right? And then we got more data and we realized that was not the case. And for the longest time we thought that everything in the universe could be described by Newtonian physics. Mm-hmm. And then we realized that that wasn't the case, that the infinitesimally small in the quantum realm, you could not apply Newtonian physics. And that's where, you know, the whole you know, field of quantum physics and quantum theory evolved. And I am convinced that as we understand more about, you know, what happens at the quantum level, we will better be able to explain, you know, the biofield. So it is, as you know, the energetic field that is, you know, us. Mm-hmm. And we take advantage of that when we do things like EKGs and X-rays, EEGs of the brain. I mean, we take advantage of the fact that our body gives off energy. Yeah. And there have been many studies that have been done, you know, whether you're talking about, you know, animal or human studies, that look at how the biofield can both be measured and how it can be influenced. Mm-hmm. And the good news is that there's more data coming. I think one of the hardest things, you know, for people to grapple with when it comes to this topic is the fact that it's not something that's easy to measure. Yeah. And it's not something that is necessarily easy to feel, but you can be trained. And it's a skill. It's not a gift. You don't have to be born with this. You can be trained and you can practice and you can learn how to detect the biofield and perturbations in the biofield. And there are a multitude of different techniques out there, everything from Reiki to healing touch to therapeutic touch, reconnective healing, and so on, that are basically very similar. They just take advantage of different energy frequencies and slightly different techniques. But to your specific question about the applications of biofield science and how is it actually being applied, I mean, we know there have been many studies that have been done looking at the impact of you know, doing biofield work on lowering anxiety levels and pain levels in, you know, folks that are suffering from those conditions, whether they are, you know, cancer patients or otherwise. We've also seen, you know, data produced in laboratories, for instance, up at the University of Connecticut. Yeah. Some studies have been done with therapeutic touch, looking at the influence of osteoblasts growing in culture, the influence of therapeutic touch on tumor growth and metastasis development. And there's some very interesting data that have been published around those particular topics. So I think, you know, there are organizations like the Consciousness and Healing Initiative, the Institute of Noetic Sciences, working together to try to move this field forward. Yeah,
and certainly I'm not a Reiki practitioner and I need to be trained in that, but I think one kind of takeaway point I learned from this conference definitely is intention, and that is manifested in energy and even heart coherence. So, you know, I kind of sometimes catch myself if I have a simple urgent care kind of cough and cold, here's your prescription, wham, bam, see you later. But making that intention of you care and asking about the patient and their situation and really putting that intention you're there for them makes that difference in their recovery of recovering faster. So that's kind of my takeaway too from this conference, and that intention matters, and it can kind of bleed into the patient's recovery. So
absolutely. I mean, I think, you know, the foundational tenet that we teach in biofield theory is that energy follows intention and energy follows attention. So wherever you direct your intention and attention is where the energy will follow. So you can really influence your day, you can influence outcomes, you can influence your interactions with patients, and even your patient's trajectory by the intentions that you set and the space that you hold when you enter into a room to examine a patient for whatever it might be.
Yeah, thank you. And then it's just, I guess, that bittersweet news we just heard that you're going to be stepping down from as a faculty or director, but also it's going to be exciting news. And so what's the next step in your journey now?
So the next step is to go back to clinical care, which I've been away from for a few years. It's just something that I've really missed. I've missed, sitting down with patients and hearing their stories and helping them on their health journeys. And as I mentioned this morning at our graduation ceremony, these last few years have been so influential on me in ways that I had not realized until I got back into the clinical arena. And what I've noticed is that all of this work that I've done with, you and your classmates and the many cohorts who have graduated before you has really allowed me to very much be in my heart when I'm with patients and to really be present for them. And you know how it is in medicine now. It's like we have a computer and we have to type in things. And that really is an interruption. I mean, it sometimes can physically even be an obstacle between you and the patient. And so creating that sacred space to help facilitate the patient's healing, that therapeutic encounter, that relationship, it's so important. And so much of what I am using now in my practice, I was reminded, while I was serving as the director of the fellowship program and interacting with all of you. And I really feel like I have stepped back into clinical practice with a fresh set of eyes.
Is that going to be alchemy of art and healing?
So the alchemy of art and healing is what I will hope, in the not too distant future will be my business. One of the things that I'm very passionate about and have always loved ever since I was a little girl is art. And I have been able to come back to art in the last few years, because I've rearranged my schedule and I'm not working 80 hours a week. And so the things that I have always loved to do, draw, paint, make jewelry, I've had a chance to come back to. I actually sell some of it now, and I really, when I do step away full-time from medicine, that will be my next full-time venture, is to start my own business and continue to do art. So yeah, and look, the other thing I'll say is that art is also a vehicle of healing. And I have seen that, in my clinical practice over the years. When I worked up in Connecticut, we used art therapy. It's an important, one of the many integrative modalities that we have at our disposal to help facilitate healing.
All right. Well, definitely I'll get your information and I'll put out where we can find you on your next journey, on your art, where you sell it, and also where we can find you when you're going to be practicing.
Absolutely.
So thank you for taking the time out here.
Yes, my pleasure. Thank you.